Hi everybody, it's David Porter, and before I begin my video I want to remove my delicious Moroccan mint air freshener so it's not in the way of the camera. This smells so good. Smell that. Isn't that great? You can smell it through the camera. Okay, so this morning I want to talk about mental illness. And the first thing to know is that mental illness occurs on a continuum. The likelihood of a person going through their entire lifespan without experiencing some degree of mental illness is more or less non-existent. It would have to be an extremely rare, exceptional individual that maybe there's some statistical anomaly, but bottom line is everybody during their lifetime will experience some degree of mental illness. Now, what defines mental illness? What the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, currently in the 5th edition, published in 2013. The DSM-5 is widely regarded by many clinicians as being the absolute worst version of the diagnostic manual that's ever been produced. It is packed with what the fuck were you thinking when you wrote this? One of those criticisms is the DSM-5 has grossly expanded the definition of psychopathology or abnormality, where pretty much anyone and everyone can get some sort of diagnosis. So what I want to talk about is specifically severe, persistent, chronic, and typically disabling mental illness. There are many, but I want to concentrate on schizophrenia, bipolar disorder, post-traumatic stress disorder, depression, and obsessive compulsive disorder. Those, the big five, those tend to be very commonly encountered. So, schizophrenia. First thing to know about schizophrenia, it has absolutely nothing to do with multiple personalities. Dissociative identity disorder, formerly known as multiple personality disorder, is an extremely rare psychiatric disorder rooted in trauma, and the existence of it is so rare there are many clinicians and researchers who doubt it is even a valid diagnostic category. So schizophrenia has absolutely zero to do with multiple personalities. Schizophrenia is a psychotic disorder. A person with schizophrenia is going to experience gross deficits in reality testing. That is, they are going to be largely unable to separate what is external objective reality from a product of their own mind. This will typically be manifested in a series of what are called positive symptoms. Positive absolutely does not mean anything good in this case. Positive just means they are very apparent and obvious and easily observed. The positive symptoms of schizophrenia are, this lady is coming so close to me in her car right now. That was way too close in this parking lot. The positive symptoms of schizophrenia are the patient will have auditory and or visual hallucinations. They will hear voices and they will see things that are not there, that only they can perceive. They will also tend to have delusional thoughts, very bizarre and completely implausible thoughts, often of a paranoid nature. They will feel like they were being persecuted, watched, followed. People are plotting against them to do them harm. And there are a multitude of negative symptoms, and negative symptoms are much less apparent, but they contribute to the entire diagnostic picture and the severity of the disorder. And those are amotivation and apathy. That is, lack of motivation and indifference to important matters. They tend to have extremely poor hygiene, gross neglect of personal hygiene, failure to maintain minimal personal hygiene, and they tend to have hypersomnia. That is, they will sleep in excess of 18 hours a day. And their sleep cycle will often get reversed, where they will be up all all night, and sleeping occurs mostly during the day. And sometimes hypersomnia, sometimes they have within normal limits sleep, but their sleep pattern will often be reversed. So schizophrenia is severe, chronic, and disabling. It is not a disorder you can live with. It must receive very aggressive treatment in order for the patient to have any quality of life. First tends to appear somewhere around ages 17 to 19 is average. And it can be rapid onset where symptoms emerge very explosively and suddenly, or it can be insidious, gradual onset where the symptoms unfold over a period of months or a year. So that's schizophrenia. Schizophrenia is generally not amenable to psychotherapy. Freudian or psychodynamic therapy with its heavy abstractions will do nothing but make schizophrenic symptoms worse and add to their distress. There is some research indicating cognitive behavioral therapy can be useful in schizophrenia, but I actually remain I'm very skeptical of that. Antipsychotic meds are the first-line treatment of choice, and the only treatment which has been shown to be effective, although the older first and second generation antipsychotics, more about that in a different video, tend to have side effects which are intolerable and arguably as bad or worse than the symptoms. That's schizophrenia. Bipolar disorder. Okay, first thing out of the way, bipolar disorder has absolutely nothing to do with mood swings. Someone who has mood swings does not have bipolar disorder. That is not the definitive symptom. Mood swings are more clinically known as labile mood. That is a mood which is unstable. Someone can be laughing and smiling happily one minute, the next minute sobbing hysterically, and after that laughing hysterically, and then scared to death. And that is a labile mood. Nothing to do with bipolar disorder. Bipolar disorder is when someone will have a period of depression which will typically persist months, maybe weeks, more likely months, up to a year, maybe a little more than a year. It's going to be long term. You're going to cover the symptoms of depression in just a minute. The episodes of depression are going to alternate with periods of hypomania or mania. Hypomania being a little manic, mania being very manic. A person who is manic is going to be deliriously happy over nothing in particular. They're going to be very excited, very dramatic, speaking very rapidly, thoughts racing. They may not need to sleep, they may have no appetite, or they may eat everything they can get their hands on, and they tend to engage in very impulsive, reckless, often high-risk behavior. They will be talking and talking and talking, but what they're saying really will not make a lot of sense. It'll be very repetitive, dramatic, very loud, very animated. Something interesting is people in a manic state also tend to wear very bright colors, neon fluorescent colors, or women will put on like bright orange lipstick and they won't color in the lines. They'll put on makeup like a clown. The other component of bipolar disorder is the depressive part, bipolar, mania, and depression. There's a very, very inconsiderate helicopter flying over right now, competing with the sound of my voice. How inconsiderate of that helicopter. They're going away. Okay. The depressive state, and you can have unipolar depression, that is depression only without bipolar disorder. Depression is not just sadness. Let's get that right out of the way. Depression and sadness are nothing alike. Sadness is one of the symptoms of depression, but it is not just I feel sad and for a few minutes or hours or even days. This is sadness that you feel most hours of the day, almost every day of the week, for at least 6 months at a time. That isn't precise. If you have depression for 5 months and 3 weeks, well, you're still depressed. So this isn't precise, generally speaking. Someone who is depressed is going to be very sad most of the time for an extended period of time. They're also going to have apathy and indifference. They're going to not care about things they need to care about, life responsibilities. They are going to be lacking in motivation and energy, energia and amotivation. lack of energy and motivation. They may be thinking about suicide or death. They may attempt to commit suicide. They may be suffering from hypersomnia, meaning all they want to do is sleep, or they may have insomnia. They may eat nothing or overeat, and they're very likely also experience anxiety, irritability, agitation, and restlessness. And they're probably hurting. Headaches, stomach ache, backache, muscles and joint aches. They're probably hurting. That's another feature of depression. So very, very different from being sad. In fact, nothing to do with being sad. Sad is normal. Sad is unpleasant. It's normal. It's not the same as clinical depression. True clinical depression, severe, is disabling. It's incapacitating. So, two others very briefly. Post-traumatic stress disorder. A traumatizing event is going to leave you feeling unsafe. Your sense of safety in the world is going to be ripped away. You're going to be very easily startled. You are not going to like anyone sneaking up on you or touching you unexpectedly. That's not going to turn out happy for either party involved. You will have a lot of difficulty sleeping. When you do fall asleep, you're going to have nightmares, and you are going to have flashbacks, very vivid waking memories of the trauma. You're actually going to be auto-hypnotizing and dissociating, disconnecting from reality when you have these flashbacks. Now, all the disorders I've mentioned so far, unfortunately, drugs and alcohol will often be part of the diagnostic picture because these people are suffering terribly. They want relief. The schizophrenics want to quiet the voices in their head. People that are depressed want to shut off the pain they feel. People with PTSD want to take themselves out of that fight, flight, freeze state they're constantly in, activate their parasympathetic nervous system and slow everything down. But unfortunately, alcohol will do that very quickly. But you will pay a very big price tag for relief drinking, for using alcohol as medicine to relieve your symptoms. That will not turn out well. Any problems you have will be exponentiated when you try drinking alcohol to fix them. Last one for now is OCD, obsessive compulsive disorder. Again, very misunderstood. Obsessive compulsive disorder is a neurological disorder rooted in the right frontal lobe. It's also classified as an anxiety disorder. Very often, depression will accompany it. All too often, drinking will accompany it, and an effort to shut it down. OCD, obsessive, intrusive, unwanted, distressing thoughts and images that come into your head, and then a compulsive behavior you feel like you have to do to counteract these thoughts, though you know it's futile. OCD is arguably the worst of these disorders because there is no separation from reality. You know this is not real, it's a product of your own mind, but you can't shut it down. All of these disorders are treatable with medication to a great extent. OCD and PTSD, depression, treatable with cognitive behavioral therapy, and lifestyle changes, which I've explored in other videos. You gotta sleep. You gotta get restful sleep. You need to eat healthy food, clean food with low salt, fat, and sugar. Pick up heavy shit and set it back down. Get outside, get exposure to sunlight, and surround yourself with people that are positive and supportive, ambitious, motivated, successful, happy, people going somewhere in life, law-abiding and sober. And yes, I am fully aware it's very easy for me to sit here and say these things, a whole other matter to put them into practice. I know that. But for the record, these are things that will help, and very often lifestyle changes can reduce symptoms to a subclinical level. So, thank you for watching, and please be safe, and please hit subscribe.